The state of dental health in the Middle Ages was far from ideal. Tooth decay and gum disease were widespread due to a lack of proper hygiene practices and a diet that was high in sugar. People in the Middle Ages ate sugary foods like honey, mead, and sweetened fruit, which contributed to high rates of dental problems. In addition, there was a lack of understanding about the importance of cleaning teeth and gums, which led to a build-up of plaque and bacteria amongst many of the people that lived during these times. The lack of proper hygiene practices in the Middle Ages meant that people had to rely on other methods to try and keep their teeth clean. Some used a type of tooth powder made from ground up bones, shells, and other abrasive substances, whilst others used twigs or sticks to try and scrape off plaque and tartar. However, none of these methods were particularly effective, and dental health suffered as a result. The poor state of dental health in the Middle Ages was further exacerbated by the lack of proper medical care. Dentists were scarce, and the ones that did exist often had little training or knowledge about dental health. This led to a cycle of poor dental health and inadequate treatment, resulting in widespread suffering during this time. Toothaches, abscesses, and other painful dental problems were common in the Middle Ages, and people were desperate for relief. As a result, they were willing to undergo painful and barbaric treatments in the hopes of finding a solution. Tooth extraction using pliers or other crude tools was a common practice, as was filling cavities with dirty substances like feces or urine. Dentists believed that these substances had medicinal properties and could help to heal the tooth, but of course, we now know that this was completely untrue and only served to spread infection and further worsen the patient's dental health. Surgery was also performed using primitive and often unsanitary techniques. Dentists would use chisels or other blunt instruments to perform procedures, causing extreme pain and often resulted in further damage to the mouth. In addition, medieval dentists used tools such as pliers, chisels, and even knives, which were often unsanitized and could spread infection from one patient to the next. There was a lack of sterilization techniques in medieval dentistry, which contributed to the spread of infection. Dentists would reuse instruments without properly cleaning them, which would increase the risk of disease for future patients. In addition, the lack of advanced tools and techniques meant that medieval dentistry was often ineffective at treating the dental issue. In some cases, the treatments actually caused further damage to the mouth and the teeth, leading to additional pain. One of the most disturbing aspects of medieval dentistry was the lack of concern for patient comfort and well-being. Dentists of this time period were more interested in extracting teeth or performing surgery as quickly as possible, regardless of the pain it caused the patient. For those who couldn't afford a dentist, the situation was even worse. Self-treatment or treatment by non-professionals was common and often resulted in further damage to the mouth and teeth. In some cases, people would try to extract their own teeth using whatever tools were available, such as knives from their own homes. This resulted in extreme pain and also caused lots of infections. The lack of pain-reducing techniques and medications made the experience of medieval dentistry even more unbearable. Anesthetics and painkillers as we know them today did not exist, so patients had to endure treatments without any relief from pain. One of the most shocking aspects of medieval dentistry was the use of leeches to treat infected teeth and gums. Dentists believed that leeches could clean the infected area by sucking out the infected blood and fluids. Of course, we now know that this is completely untrue as well, and that leeches only helped spread infection and worsen the patient's dental health. In addition to leeches, medieval dentists also used a variety of herbal remedies and concoctions to treat dental problems. These remedies were often made from plants and herbs that were believed to have medicinal properties. However, there was very little scientific evidence to support the effectiveness of these remedies. They often had little to no impact on the patient's dental health, and in some cases, they caused further harm. Overall, the horrors of medieval dentistry were the result of a lack of proper medical care, the use of crude instruments, and unsanitary techniques, not to mention the reliance on superstition and folklore rather than evidence-based medicine as we know today. It's no wonder that people were desperate for a relief and were willing to undergo painful and barbaric treatments in the hopes of finding a solution. Thank you for watching this video. If you enjoyed it, please leave a like, drop a comment and subscribe to the channel. We'll see you in the next video.